Hey there, I'm Brian Weatherby, one of the orthopedic foot and ankle surgeons at Stedman Hawkins Clinic of the Carolinas and Greenville Hospital System's University Medical Center. Today we're going to talk about total ankle replacement. Total ankle replacement is a procedure that's used to address ankle arthritis that may be present for several different reasons. Ankle arthritis can develop without reason, just as arthritis in your hip or knee that is associated with osteoarthritis or general wear and tear on the joint. Ankle arthritis can also develop as a result of a previous injury, such as an ankle fracture, which is a quite common fracture that occurs as a result of a twisting injury to the ankle from a fall, accident, or blow to the ankle. Ankle arthritis can also develop because of various inflammatory conditions of the body, including rheumatoid arthritis, and various other inflammatory arthropathies that are known to exist. In addition, other conditions that are less common can cause ankle arthritis, although we will not discuss these today because they are so rare. Ankle arthritis can be addressed by other means besides total ankle replacement as well. Before you should ever undergo a surgical procedure for your ankle arthritis, you should pursue treatment with various different modalities. These would include physical therapy, brace treatment, as well as injections. Injections that are used to treat ankle arthritis commonly are cortisone injections, as well as viscosupplementation injections. Viscosupplementation injections are currently not FDA approved for ankle arthritis. However, they are commonly used off-label with good results. Once your ankle arthritis becomes symptomatic past the point of non-operative measures, then surgical intervention must be considered. Again, multiple surgical procedures exist for the treatment of ankle arthritis. These include simple arthroscopic or open debridement, which is cleaning up the joint and removing bone spurs, a procedure called distraction arthroplasty, which involves the previously mentioned cleanup procedure and stretching the joint apart with an external fixation device. Sometimes osteotomies or bone cuts to move the bone in the right position are used as well. Total ankle replacement, which has gained favor in the last 5 to 10 years in this country, has been performed in Europe much longer. There are various long-term outcome studies in Europe that have shown the positive effects that a total ankle can have in a patient's life, and that it is a durable device to be appropriately used for ankle arthritis. Traditionally, two-part ankle replacement prostheses have been used that included a tibia component with the plastic component attached to this and a talar component. The tibia component sits and is attached to the tibia bone. It is usually anchored into place by press fit type of implantation. And again, the polyethylene or plastic component is attached to this traditionally. The talar component is usually a cap that sits on top of the talus bone, just as a hat sits on top of your head. The newer devices typically leave the fibula bone alone and simply remove the cartilage from this bone, but do not replace or put any component onto this bone at all. More recently, the FDA has approved a 3-part total ankle device that was approved for use in June of 2009. The difference between this device and the previously mentioned devices is that the plastic or polyethylene component does not attach to either the tibial or talar metal components and is free-floating, if you will, inside of the ankle joint. This allows not only up and down movement of the ankle, but also some side-to-side and rotational movement of the ankle, so as to allow the natural ankle movement that we have with our native ankles. Total ankle replacement is currently available, and myself and my partner, Dr. Tom Anderson, are performing this procedure. Total ankle replacement involves a surgery which usually takes about 2 hours of operating time You will typically have a stay of 2 to 3 nights in the hospital after the procedure is performed, during which time you will work with a physical therapist to begin walking while not placing any weight on the side that you've had the ankle replacement done. You will initially be in a cast to protect your leg and to allow for appropriate wound healing for about 3 weeks, during which time you cannot place weight down on the leg. The cast will then be removed at about the 3-week point, and you'll be placed in a boot and begun weight bearing progressively over a 2 to 3 week period, and also begin physical therapy to strengthen your ankle once again and to train your ankle to be able to use the total ankle replacement that has been put into place. Generally, complete recovery from the total ankle replacement, just as in hip and knee replacement, takes up to about 6 months. You should be walking without pain and without an assist device by 3 months and have continued improvement up until the 6-month mark. At this point in time, the most common complications from total ankle replacement are wound healing problems, as well as nerve injury and component malposition. Total ankles are gaining in popularity, and patients are very excited about the results that they are gaining from these, with pain-free activity and the ability to retain motion about their ankle. In addition to retaining motion about your ankle, you're also able to maintain the integrity and shape of your calf muscle, which would otherwise dwindle with ankle fusion. You're also able to more readily participate in desired activities such as hiking, golf, walking exercises, biking, elliptical machine, and swimming with the total ankle in place versus a fusion. If you have any other questions about this procedure or would like to have a consultation regarding a total ankle replacement, please feel free to come in at any point and see myself or my partner, Dr. Tom Anderson, and we will be happy to discuss this at more length with you and in more detail.